Hey everyone, this is Craig Davies from PPCIL, and he's going to talk about SSI and SSDI.
Kind of a little bit of an overview of Social Security supplemental income and Social Security disability insurance. First, a little bit about who we are. We're the Brazos Valley Center for Independent Living. I am the program manager. And Centers for Independent Living, there are actually 27 of them in Texas, over 400 worldwide, and we are community-based and community-run. And we serve people from birth to death with disabilities to help them live as independently as they want. So over half of our staff are people with significant disabilities, and also our council, our board, are also people with disabilities as well. Every center is a little bit different based on the community that they serve, because they are community run. But every center has the 5 kind of core services that we all do, which is advocacy, helping people advocate for themselves, information referral, when people have questions, being able to refer them to the right organization. We do peer support, like matching people that have had either similar life stories or similar disabilities, so they can use each other as a resource. We teach independent living skills classes, and we also do transition, which is kind of a two-pronged. There's a lot of hospital diversion or institutional diversion. If people do not want to live like in a nursing home, we help them to stay as independently as they can. And we also do a lot of vocational work with youth that are transitioning from high school to either work or college. So those are kind of the 5 basic core services that we provide. So, and again, benefits counseling, and that's part of what I do. I am not an expert by any means, and just know that I've rarely had 2 of the same question. Basically, everybody's is individual, and the issues that arise or the situations that come up are very individual. So, will I know the answer to your question? Maybe not. But what we can do is, I do have a table outside. You can come to me, and we can even schedule a time for you to come in, and I can kind of sit down with you to kind of see what your situation is and what's the best way forward. So when people think of disability, they think of it kind of under one umbrella, but it's actually 2. So there is Social Security supplemental income, which is SSI, which is not paid for by Social Security, but Social Security directs it. And then there is SSDI, or Social Security Disability Insurance. And that is when a lot of people assume they're going on when they get disability, but it just depends. And I'll try to go over that, of what that difference entails. For SSI, so SSI, it's a federal supplemental income program. It's designed for people who are older, or people with disabilities, or children of people with disabilities. The most that you can get through SSI is $967 a month. That's up from $943 last year. So they got a raise. Or for $967 for individuals, or $1,450 a month for a couple if they are both eligible for SSI. So the way that they determine how much you're going to get is determine how much, if you are currently working, how much are you making, because there is like an income limit to it. So what they do is they basically take your monthly salary, your net, they divide it in half, minus $85 from it, and that, with the difference from $967, is what you could expect to get from SSI. So like I said, it's for people 65 and over, and you can be on SSI and SSDI at the same time. If you're receiving retirement and your retirement check is below that 967, then you can receive some additional from the SSI side, and also be eligible for Medicaid as well. So when you apply for SSI and you are approved, you are eligible for Medicaid, and also the other like SNAP benefits and things of that nature. Let's see. So an important thing to know about SSI is since it is income based, it's also based on like the assets that you have. You can have a house, you can have a car, and then after that, they start looking to see exactly how much that you do have in assets. And you can't hide it because there's a Social Security Administration and they can look. And they do what's called a look back. They'll look back, I think probably about 5 years to see, does your income, has it fluctuated much? Was there money there then all of a sudden gone, like it's being transferred to somewhere else? So they are really good at looking at those assets. And so for an individual, the asset cap is $2,000 a month, and it is for a couple it's $3,000. And the monthly limit is $2,350 per month, and the annual limit is $9,460 in 2025. So what they look at when they're looking at eligibility, it's the SGA, or the substantial gainful activity. And what that means is it is based on it's eligible to be eligible for disability benefits. A person must be unable to engage in SGA. If a person is making more than a certain monthly amount, that is called SGA, and they will not be eligible for SSI. And the amount is considered for SGA. It's based on the nature of the person's disability, and also if it's based on the income index that comes out yearly. So the SGA amounts for 2025 is $1,620 for non-blind for one person. It is $2,700 for somebody who is blind. And if you're under a trial work period, and we'll kind of go over that in a second, you can make $660 a month, and anything above that you would not be eligible for SSI. So a lot of people are wondering, am I getting SSI or am I getting SSDI? You can also, a really easy way to know is like, do you get paid on the first or the third? Mm-hmm. And ask me which one it is, because I'm wrong half of the time. So, but did you pay into Social Security for at least 10 years? Do you receive Medicaid? That's a big indication that you're getting SSI and not SSDI. And is the amount of the monthly benefit $967 or lower? But no more than $967. So SSDI. So the difference between SSI, one of the biggest differences in SSDI is based on your work credits. It's what you've paid into Social Security throughout the years. So they look at 40 quarters, which is about 10 years, and they don't have to be consecutive, but they it's kind of like a grid, and they will show you exactly how many credits that you have, and that will determine if you're eligible for SSDI. Of course, that is also contingent on the type of disability. There's a lot of, I'm sure if anyone's gone through the process, there's they have your medical records, income, daily function reports, and a lot of that also applies to SSI as well. So within 2 years, at 2 years or 24 months after receiving or being approved for SSDI, you can get Medicare Part A, or you can get Medicare Part A and B if you pay like a monthly premium. RSDI eligibility date. There are a few. It's usually a long process getting SSDI. There's no getting around that. It usually takes about a year. Chances are, the first time, don't expect to get it the first time, that you will probably just be prepared to be denied, and there is an appeals process to that. And it's the same for SSI as well. I've seen people that apply and they are clearly have a disability that is not allowing them to work, and they will get denied and said with the letter stating, yes, we know you have a disability, but we still think you might be able to work. So they're be prepared for that initial denial letter. Just know that there is an appeals process that goes all the way up to a determination judge. So, and so once SSDI will turn into retirement once you get to the age of either 62 if you take early retirement, or 65, and then it becomes just like the regular pension that you would have drawn from Social Security, just based on what you paid into it. So a couple of questions to see if you are on SSDI instead of SSI. Did the Social Security Administration or DDS determine the individual to be disabled? That is straight up from like the Social Security Administration, not your local Social Security office, but the administration. Are they the ones that made the determination that you were disabled? Adult children with disabilities whose parents retire or passes away will be switched from, if they're receiving Social Security supplemental income, they will take on, or they'll be switched over automatically to SSDI, and they'll be eligible for Medicare as well. We kind of went over this. It's based on your work credits, 10 years of work, and they do not have to be consecutive, like I said. So if someone is not receiving Social Security benefits when they turn 65, they must contact the Social Security Administration office 3 months prior to turning 65 in order to get the Medicare. So if you're getting close to that age, just know that at least 3 months before, go ahead and apply, so there's no gap in between you getting the benefits and then not Medicare. So a couple of things, work incentive programs. So work incentive programs are for people that are getting SSI or SSDI and want to go back to work. Because they either, sometimes they physically have gotten like somewhat better to where they can work, or they just want to not have to rely on that check every month. So there are work programs put in place to where you won't lose your benefits while you're trying to see if working is going to be an option for you. So there are 2 work incentive programs. One is PASS and Ticket to Work. So Ticket to Work, it's a free and voluntary, and it connects with free employment services to help you decide if working is right for you. The ultimate goal is to assist people receiving Social Security benefits and reducing the reliance on the disability benefits. The Ticket to Work program, it is free of charge. It is administered by the Social Security Administration. And the receive the services as career counseling, vocational, VR, job placement, training. The Ticket to Work program, it's also part of what's called the WIPA program, the Work Incentive Program. And through that, it's a regional program. The one that facilitates it out of this region is actually the Houston Center for Independent Living. And what they do is they do in-depth benefit counseling and find you resources for training to get back into the work. And another one is PASS. So PASS, it's almost kind of, think of it like a savings account. Like I said, that there was a limit to how much you can have in assets, which is $2,000 for individual, $3,000 for a couple. So this is a written agreement between you and the Social Security Administration office that says, given this amount of time, and that just depends on that individual plan, we're going to let you put extra money into this account, and it will not count against you as far as getting benefits. But again, it's very individualized. So I can't tell you like you can have, how much money you can have in that account for how long. Again, it's based on an individual plan. And this is the information on the past work incentive. I don't know if they're going to get a copy of, like a hard copy of our.
Yes, everything that the slideshow will be posted on the website.
Okay, great. Because there is some. So here's also some really good information and it kind of touches on everything that I spoke about today. And so, like I said, I know everybody has like individualized questions, and I'll try my best. So I'll open it up if you have any questions. Yes.
Can a 14-year-old child get SSI? Or?
Yes.
Okay, but like if I'm working though.
It is. So if they are under the age of 18, they are eligible for SSI, but it will be based on your income.
Okay.
So if your income, but again, it's worth looking into.
Yeah.
Um,
Probably too much, I guess.
Yeah, you may, and they would not be eligible. But if they are eligible once they turn 18, they will have to reapply because that's when they start looking at it from an adult disability side. Yes.
So once they transition to 18 and they already receive SSI,
Mm-hmm.
but if I'm still the represented payee, do they still go by my income, or is it just her?
No, the rep payee, because you can have a family friend as a rep payee. It doesn't necessarily have to be a parent or guardian, but once they turn 18, they do need to reapply for the adult SSI. And it's based on their income, except, and a good thing I like to tell people is if you have an adult child living with you and they are applying for benefits, a good thing to do, because they will look at house, room, and board, and they will look at like, well, how much are they actually paying in rent. So a good thing to do is actually to have a rental agreement between you and your adult child, and have it spelled out just like a regular lease. In fact, you can use like a template of a lease agreement that you can find online, and that'll just show them how much they're expected to pay, room, board, utilities, just list it all out, itemize it. So that way it'll give the Social Security Administration a better idea of exactly where their income is going if they have any. Yes?
Can an individual have a pass account and an ABLE account?
I don't know the answer to that. I can help you find out after here, but I don't know that on the, yeah, I'm sorry. Yes.
What services do you provide again, and is it like paid, or what type of services do you provide, and is it like paid by, the government, or?
What, like the BBSIL that
Yeah.
provides?
Yeah, usually.
Well, we don't have like give out like monetary services, but we do direct services, like I said, like doing vocational programs for people that are transitioning to help them find work. And it's not just for young adults. We can also take referrals from TWC they'll give us a service authorization to help them to do that work development piece and to actually find employment, help you find placement.
But does the parent and tenant just go directly to you?
Yes.
Mm-hmm.
Absolutely, and my information is at the beginning of this. Actually, I think it's right here. Yep. So this is actually our mainline number, so anybody can call. And like I said, we help people from birth to death with any type of disability. You do not have to tell us what your disability is. Just all you have to do is self-identify as someone with a disability. Yeah.
Can you walk us through the application process, how that whole thing works? We started to fill out something, and it was something about making an appointment, and something about you don't need to bring all your paperwork, but we'll help you gather this, and then something, and then we just kind of got like, I don't even know what we're doing, and so we are.
Yeah, well, they don't make it easy for a reason. So I'm glad you brought that up, because one of the things that I do is when someone comes in, if we determine that, yes, they may be eligible for, let's say, SSI or SSDI, I contact the local office in Bryan College Station. I don't call the 1-800 number, because you will be on hold for I've been on hold for an hour and 45 minutes. And then you find out that you're in the wrong place. So I call the local office. They usually, now the trick is they have like up to a 15-minute hold time, and then they'll just say, well, sorry, call again later. But they are usually very responsive. And so when somebody comes in and they want to apply, there's two things I tell them. One, set up a myssa.gov account. It's very important. In that, if anybody is over, and anybody who is over the age of 18 can set up one of those accounts. I set mine up, and it was fairly easy, except I did not write down my password. You want to keep that; it's like gold. But once you get into that SSA.gov account, it'll show you how many work credits you have. I mean, it'll list out every how much you've made annually since the time you started working. And it also will show you what it, like if you were to develop a disability today and have to go on disability, what you would expect to get from SSDI. And on the SSI side, it'll show you what you're getting as far as benefits, the eligibility. You can apply online through my SSA.gov, and it's all one application, so they determine which way it's going to go. But one of the easiest ways I found is when people come in, I help them set up their my SSA.gov account, but then I call the local office and they'll do what's a pre-interview or a they just basically get your demographics, your information, basically why you think that you may need disability. And they will set up a phone interview, and it's really important that you take that phone interview because it's usually about 4 to 6 weeks out, and it takes about an hour, but they will actually do the application over the phone with you, and that's much easier. And then once you have done that, you can probably expect in maybe 2 to 3 months, you may get a couple of packets in the mail. One of them will be like for medical information, which they're already pretty much going to be able to get anyway, and also like a daily function report, which kind of tells them what do you do hour by hour, basically every single day. Like what time do you wake up? What do you do when you wake up? Do you make your own breakfast? What do you make for breakfast? I mean, it's very detailed because they really do, and that's where you really do kind of want to thread and make that story of why you think that you should be getting disability.
I know, like, just because I was a diagnostician for 15 years, and like, your school will also get the form. Your teacher will get an SSI document to fill out.
Mhm.
Send back.
Yes.
And as a parent, you may just want to like stay on top of that, because if the school just throws it in the trash, then that's a big part of your application, and you need to make sure that they fill it out. Because I filled it out, you attach their evaluation and things like that.
And it's also very important to always report your earnings to Social Security, because they will find out at some point, and you do not want to get stuck with an overpayment, because they will take a look, and if they find that starting 3 months ago, you're making $100, even $100 more a month that you did not report, and they will consider that an overpayment, and you will have to pay that back. Bless you.
Thanks.
Any other questions?
So, piggybacking off of what I asked, my son is 14, he's in 7th grade. He is currently, living at home, and I mean, we don't necessarily need all this, but he's on the autism spectrum and he has debilitating OCD.
Mhm.
I feel like he could probably find a job in his autism spectrum disorder, but his OCD right now is so debilitating that like he can't, I think he would be fired from any job because he has to wash his hands so frequently and can't touch things, and like, I mean, it's just, I can't see him holding down any kind of functional job right now. And so I guess we had I'm in a group of moms who have special needs kids, and somebody came and talked to us about this in the fall. And I mean, I know what I'm looking for is what's gonna happen when he's 18 and moving on for the rest of his life, and like those kinds of things. So it's okay that this process takes a while. I just want him to be able to, he needs he's on his battery, he sees a psychiatrist to do his meds. If he doesn't have insurance, he doesn't have like health insurance, like he won't function at all.
So I'm sorry.
No, so, and then we also homeschool, so I don't have a school that's going to like give me a report or whatever. And so anyway, can you tell me how all
Yeah.
this works as far as going forward?
I don't know, I mean, from the homeschooling standpoint, I know just from the public education standpoint that, you know, a lot of people with similar disabilities, if they've gone through the special education process and they've had an IEP, they can get services through the Texas Workforce Commission VR services, and they will help train them. They'll give them assessment to see what their job readiness is. And they reach out to people like us, and we're like, okay, we'll give you authorization to help this person with, you know, job placement or whatever piece that they need the most. We do, and this is kind of away from this, but we do run a couple of vocational programs through BBSIL. We have one that is called Project Search, which if they are in their last year of high school, will have enough credits to be able to graduate at the end of the year. If they're in an 18+ program, especially if they're about to age out at age 22, we can through VR services get them the special. They have an instructor from that school, and there's an internship, you know, business. And for one of them, it is Scott and White, the one off of the big one off of Rock Prairie, and we have, I think, 7 interns there, and with really different levels of functionality, you know. And so you'd really be surprised because you know they always seem to have that one thing that most people don't, and that one thing is that, you know, kind of, it's just finding that one thing and finding that job that needs that one thing sometimes.
We have professional gamers.
No, but they're good with technology.
On that same question, with, like, we're on pathways right now, and
Uh-huh.
we about to age out.
Are you through Bryan ISD
No,
or
we are
College?
Station.
College Station? Okay. You've got a good group there.
After that, what do we do?
Um,
Because, and I'm here, I'm thinking, I have to take over, we have to take over, and where do we branch out to? I don't see him yet trying to find a job, and I see what you're saying with it, and I've heard a lot about Project Search and all of those. But if he's not right there,
mhm.
is there something in between?
Again, I would definitely go through TWC. Do they have a TWC counselor already when they're doing their ARDs and things like that?
That's something that I would have.
They have a table out here.
Yes.
So Sean Ferguson is sitting there, so it's off there.
Uh-huh.
Okay.
What is TWC?
Oh, I'm sorry, the Texas Workforce Commission? Sorry, we speak in a lot of acronyms, and I always forget to de-acronym. Any other questions? Yes.
What is the relationship, going back to our son,
Mhm.
19 years old, we have full guardianship of him,
Mhm.
he's intellectually disabled, okay? I'm retired but have a fair income.
Mhm.
What is the relationship of our income to how much he can get in SSI?
Again, I would definitely start building those boundaries of like an agreement, like a lease agreement.
Even if he's doesn't even know what he's signing?
Well, if you are the guardian, then you can sign that for him.
Okay, I see.
Mhm.
Okay, that's a great tip, I've never heard of that.
Anybody else? Yes.
And my son has right now 14 years old,
Mhm.
and he attended school in Bryan ISD,
Mhm.
and the next year he's going to high school. And I've heard sometimes for other people that he can be able to get the SSI. He has his own IP, and he is in the SPED program, but he goes to regular classes
Right.
because.
But he still has an
he's
IEP,
5
and
months
yeah,
old. And I don't know if he qualifies for that.
it would still, since he's 14, it would still be based on your income and your assets. But once they start, keep that in mind whenever, he gets to that point where he's about to turn 18, that's when, you really want to start looking at these options. Mhm. Anybody else? All right, well, thank y'all so much. I appreciate it.